2022 got away from me, so welcome to 22 and 23. Okay, maybe we'll do 23 and 23. We'll see how this year goes. So today's topic is the foreskin. And the foreskin is a sort of protective layer of skin that covers the shaft and the head of the penis, but can be retracted during sex or for cleaning purposes. Now, some of you might be wondering why the foreskin is a separate topic for me from the penis. And I wanted to give special attention to the foreskin because there are many individuals who have had their foreskin removed by a process called circumcision. And this is a procedure that's common in the United States, but circumcision is not common in the vast majority of other countries of the world. In fact, it's more common to be uncircumcised, or some people prefer the term intact, rather than circumcised. And so I want to give some special attention and education around foreskin in case you do have foreskin and you haven't learned about it, or if your partner has foreskin and you're curious, or if your children have their foreskin and you want to learn more. So let's start from the beginning. The foreskin is, again, this protective layer of skin that covers the shaft and the head of the penis, and it's present at birth. As an individual goes through puberty and grows and gets erections, the foreskin grows and stretches as well. So at birth, and really up through puberty, it's not essential that someone try to retract their foreskin, meaning pull the foreskin back and expose the head and the shaft of the penis. As puberty advances and as people get erections, the foreskin will eventually be able to retract on its own. In the case that someone is a little too aggressive and tries to retract the foreskin and causes either a tear or damage, it can result in something called phimosis, which is basically a stricture or tightening of that foreskin to the point that it cannot retract over the head and the shaft of the penis. Now, there are a couple things that can be done about phimosis. They include a prescription topical medicine from your doctor, and that can sort of slowly break up some of that scar tissue to the point where you can eventually retract the foreskin. Sometimes even gentle stretching in the shower can eventually cause that foreskin to loosen up and be able to retract, but in severe cases, it is recommended that circumcision be performed because phimosis can be painful, meaning if you get an erection and that foreskin can't retract, it is very, very painful and tight, and that foreskin needs to be relieved or released. And also, it's important that you be able to pull back the foreskin for cleaning. So again, I said you don't have to necessarily pull back the foreskin up until puberty, but after puberty, and once you're able to retract your foreskin completely, it's really important that you do pull back that foreskin, clean underneath the foreskin, just with some water in the shower, and then pull your foreskin back over the head of your penis. But it's never essential to retract the foreskin when you're peeing. I get that question a lot. And lastly, when it comes to sex, some people find that their foreskin just retracts naturally on its own, and with a fully erect penis, you don't have extra foreskin. But some people find that they do have extra foreskin, and that there is foreskin that can still rub on the shaft and actually the head of the penis as well. This isn't a problem. With condom use, it is helpful to, if you do have some extra foreskin, it's helpful to put just a little bit of lube, water-based lube, in the condom, and sort of when you put the condom on, just slide up and down a little bit the foreskin, get the foreskin up in the condom, and make sure that it can move a little bit more freely, and that should make sex with a condom a little bit more pleasurable when you have foreskin. Now, this is also an area that's very interesting because we do know that there are nerves in the foreskin, and so many people find that touching, massaging, stroking the foreskin with sexual activity actually enhances the pleasure with sex. So don't be quick to push back the foreskin all the way, but consider using it in sex. All right, so on to your questions. Question number 1. I'm 14 years old and can't get my foreskin back. Shall I wait till I finish puberty? So this is what I was talking about, that the foreskin should gently stretch and grow with the penis as you go through puberty. What I would recommend for you is in the shower, gently try just slow retraction. So just a little bit of gentle stretching every day. Just a little bit, never force it. And that should potentially hopefully get things a little bit more flexible and loose as your penis grows. Now, if in a situation you do end up trying to retract it too forcefully or too much and it gets stuck behind the head of the penis, that's actually an emergency if you cannot pull it back. The reason is that too much pressure around the head of the penis from that tight foreskin can cut off circulation, and that's an emergency. So if you were to find yourself in that unfortunate situation, you need to go to the hospital. Question number 2. I am able to pull my foreskin above my penis head when I'm not hard, but when I am, I can't. Is that normal? So I would call this mild phimosis. So not full on, you can't retract it over the head, but it's able to stretch a little bit when your penis is smaller. But when erect and you have more blood in your penis, you're not able to retract it. And so again, I would call that mild phimosis, and I would do what I just recommended for the other individual as well. It's just some gentle stretching in the shower, maybe when you do have an erection. Alternatively, you can talk to a doctor about getting that topical medication that you can put on the foreskin that will help it sort of gently stretch. All right, question number 3. It burns under my foreskin when I try to retract it. What is this? Could be a couple of things. One, if you're trying to retract it too forcefully, it could be that you're stretching it too much, and I, again, would not do that. Just do it more gently and talk to a doctor if you need a little bit of medicine to help. It's possible that it could also be a sexually transmitted infection, like gonorrhea, or some people get yeast infections of the penis too. So especially if you have a rash or if you notice any discharge, it might be worth talking to a doctor about some testing or treatment, but otherwise the burning sensation may be just from trying to pull back a little bit too hard. I'm not sure, but you can talk with a doctor if you have any other questions. All right, question number 4. I'm 15 and recently this year I discovered about pulling my foreskin back. Ever since then, every time I have tried to touch my tip, not covered by my foreskin, it hurts extremely bad. Please help. Okay, so this is very common in that, especially if you just started retracting your foreskin, the head of the penis in uncircumcised individuals can be very sensitive. So what I would do is, 1, give it a little bit more time, and things should get a little bit less sensitive with time. But the other option you can consider is a numbing cream, which I'll talk about in a minute. But especially if you're planning on masturbating or having sex, then applying that numbing cream about 15 minutes before doing so and then wiping it off can reduce the sensitivity and make it a little bit more pleasurable. Question number 5. Do you have to clean under the foreskin? It is recommended that you clean under the foreskin. I can't force anyone to bathe or shower, but we do know that cleaning out the bacteria and dead skin cells and oil that build up underneath the foreskin is beneficial for hygiene. It's good practice to clean under the foreskin, but no one can force you to do anything. We do know that good hygiene and cleaning your body is healthy. So, yeah. Question number 6. How can I reduce the sensitivity of my penis? I am not circumcised. All right, so here, this is also back to the previous question of, if you find that you are very sensitive and potentially even orgasm a little too quickly for your liking with sex, then consider using a medicine. So a topical lidocaine, prilocaine, 5% medicine can help sort of numb up the tip of the penis or decrease sensitivity. It's not going to numb it up. It'll decrease the sensitivity of the penis. I would apply that 15 minutes before sex. Make sure you completely wipe it off before penetration and see if that helps. Another thing that you can consider is a condom. condoms can reduce the sensitivity of the tip of the penis. And so if going a little bit fast, or if it's just really too sensitive to enjoy sex or masturbation, consider a condom. Question number 7. I can pull my foreskin back when flaccid, but not when erect. I have a feeling that this might be due to a tight frenulum. I looked at pictures online of a tight frenulum and what it looks like when the foreskin is pulled back with a tight frenulum, and it looks like mine. Is there a problem? Is there any stretching or anything else I can do on my own? Thank you. So, there is something called frenulum breve, which is on the underside of the penis. So there's the head, and then where the head of the penis on the underside connects to the shaft, there's a little frenulum or ligament that connects the two, and it's part of how the penis develops in the embryo, but that is where the frenulum lies, is underneath the shaft, connecting the head to the shaft. Sometimes that frenulum, we have a frenulum here and up here too. Sometimes that frenulum can be tight and it makes the head almost pull downward a little bit and can make erections especially very uncomfortable. Sometimes stretching or the medicine that a doctor can give you can loosen up the frenulum, but in severe extreme cases, sometimes a procedure is needed to release that frenulum. So I would talk with a doctor, especially if it's causing discomfort. If it's not causing discomfort and you're okay with it, then there's nothing really wrong or concerning about it. But if it causes discomfort, I would talk to a doctor. Question 8. Today I noticed a bubble-like thing under my foreskin. The color of it is the same as my penis color and also not painful. What is it? So it could be a couple of things. One, a bubble-like thing under my foreskin. So there are things called inclusion cysts, which are like debris, so like dead skin cells and oil, and they build up underneath the foreskin and could cause like a little bump. And all you have to do is really clean them out. That could be it. The other thing that it could be is a lymph node or a lymphocele. And what that is we have lymph nodes all over our body, and we have them, you have them, I don't have one, but we have them on penises as well. And especially when someone has orgasmed or had a lot of sex or masturbation, sometimes the blood flow through the lymph nodes gets going, picks up, and you can notice little enlargement of the lymph node in the penis. And it's nothing to be worried about. It should improve over the next few days or so. So nothing to be worried about, but if you have any concerns, if it does get painful, if you notice drainage, talk with a doctor. Question number 9. How will I know if my partner is circumcised? So, 1, you could ask them. 2, when erect, sometimes you can't tell. Oftentimes you can, but sometimes you can't. If erect and they have some extra skin that is around the base of the penis and sort of comes up the shaft, potentially covering the head, then that would be foreskin. When they are flaccid or not erect, there will be a layer of skin that goes over the penis and the shaft. And a penis that is uncircumcised and a penis that's circumcised, basically it just looks like the circumcised penis. You can see a very specific indentation where the head starts. And for an uncircumcised penis, it's just a little bit more smooth. And then the skin covers it. And that's it. But if you're wondering, you could also ask. Question 10. I have had sex both using a condom and without. When I had sex without a condom, the foreskin moved more easily and felt great. Is it really necessary to always pull back the foreskin before sex? And can the condom restrict the function of the foreskin during regular sexual intercourse? So, this is what I was talking about before, in that the foreskin does have nerves, and it can be very pleasurable for some people to use the foreskin with sexual activity. So, if you are not using a condom and you're sure that everyone does not have sexually transmitted infections and you don't have any pregnancy risk, then you don't have to retract the foreskin. You can use the foreskin with sex, that's fine. If you are using a condom, again, what I would do is put a little drop of lube, not oil based, and put that in the condom, and then when you put the condom on, sort of rub the foreskin, massage it up along the shaft and up into the condom, and that should allow it to move more freely with penetration and movement, and hopefully you get some more pleasure out of it. So thanks for watching, thank you for your patience, and I look forward to more questions and videos in 2023.